plant to be a better quality. They don't know that you're taking DNA from sea creatures and adding it to the DNA of a plant, so the plant's no longer a plant. And that when you take those into your body, they actually change your genetic structure and change your DNA. Have no idea about any of that stuff. So I like to raise awareness about GMOs. It's killing all our bees. Our bees are dying because we're using GMOs, so we've got to change that. Preservatives, inorganic foods, chemicals and household cleaning products. I do have a wonderful class I teach on detoxifying all the eliminatory organs, and I talk about all the chemicals that are in toothpaste, especially for you guys with babies and little kids. They're putting sodium lauryl sulfate, let's see, what else is it? Fluoride, all these things that are carcinogens in the toothpaste. And I used to go out and just buy Tom's because I knew Tom was a cool dude, right? And he sold out totally. I found fluoride and sodium lauryl sulfate. Now, you know, sodium lauryl sulfate is the stuff that makes your shampoo bubbly. It's bad enough putting it on your skin. You put it in your mouth, they have warnings. Do not give it to anybody under 2 years old because they swallow. So it's really bad for you. Chemicals in the, okay, so we've got chemicals in the cleaning products. One of the top ones is bleach. Bleach is really hard for you. And then, you know, that Purell that you use for the children, it has alcohol in it, and that's hard on the liver too. So be sure to rinse their hands off after you clean them, sanitize them. Rinse that off their hands so they're not grabbing food and putting that food in their mouth with that on it. And then electromagnetic fields. The one thing I do like to tell people is, you know those the older fashioned TVs that are kind of not the flat screens? What comes out of the back of it is 10 times worse than what comes out of the front. And I've seen so many people have it up against the wall, and the head of their children's bed is on the other side of the wall, and they're up late at night watching TV, and all that electromagnetic field's going into the bedroom with the children. So really watch if you have those older televisions or computer screens that it's facing outside your house, not somewhere where someone's being exposed to it. How to stay healthy. Eat an organic, fresh fruits and vegetables, lots of leafy greens, and their juices. Sprouted nuts, seeds, whole grains, gluten-free, beans and legumes. I always say soak it and sprout it because it has an enzyme inhibitor, and it makes that release the enzyme inhibitor so you can digest it better. Eat organic whenever possible. Meat, poultry, fish, and dairy should only use in moderation without chemicals or GMO feed. Drink plenty of purified water. You know, they use lead to weld the pipes in our house. So if you're drinking water from the tap, not only are you getting the chlorine and the fluoride and all that stuff they put in our water, but you're also getting lead from the pipes. And get lots of fresh air and sunshine. It's important to breathe. I had one client come in and she was so pale, and I knew she wasn't oxygenated enough, and I told her, you need to breathe. And she goes, of course I breathe. I'd be dead if I didn't. There's a difference between just breathing enough to stay alive and being 100% oxygenated. If people are trying to understand why they've got memory loss and all these problems with their brain not functioning, a lot of it is because our brain needs oxygen. So make sure you're breathing enough. Go ahead. Lifestyle and stress management. Exercise in nature. There's a research project that came out of Switzerland that said if you exercise in nature 30 minutes a day, your rate of cancer of any kind goes down 35%. Okay, this is not walking while you're talking on the phone and text messaging your friends. This is the stop and smell the roses walk in nature, where you're breathing and you're being present. It makes a big difference. Nurture yourself when you're under stress. I prefer yoga, aromatherapy, bubble baths. I like to pick roses and put it in my bubble bath. Choose loving, encouraging friends or a support group to help you with your personal goals and healing. Eliminate unhealthy people. food and habits from your life. Now, I have been teaching this for pretty close to 35 years total, and every time I do, I always like to say, I have seen a lot of abuse, women who are abused with breast cancer. And so I tell them, every time I tell a woman that you deserve something better, they've always said, I finally left him, and I'm so glad I did. Not one of them says, I wish I had stayed with the jerk a little longer. So it could be a boss that's abusing you. If you have a friend who you know is being abused, tell them they deserve better. Because you can't be healthy in an environment that's suppressive. And it's super important to be loved. Oh, where'd she go? Oh, thanks. How to keep your breast healthy. Be loving to your breast. Take your bra off after working all day. Dress in comfortable clothing. Can I hold this? I always like to handle my bosom. So you can see. You want to do a little drainage through here. And then massage around the breast to get the energy flowing through the breast. I also massage the tummy and the legs and the thighs, all in the direction the lymph flows. Yes.
Also, so that my understanding is that there's also a greater risk for blockage of lymphatic lymph flow with an underwire bra that does not fit correctly, or even underwire bras potentially in general.
Yes, and so, I do tell people to take it, if you have to wear a bra, take it off when you come home. And I just love the little moo-moos they have in Hawaii, and I have like this little lava I just wrap around myself and let the girls hang down there. And I do mean down there. Kind of drooped after so many years, but if you look at the body and the lymph system, what makes the lymph flow? It doesn't have a heart. The lymph is what carries nutrients outside the bloodstream into the intercellular tissue and then carries toxins away. What makes that lymph work? Exercise, movement. Where's the muscle? It's behind the breast. There isn't a lot of muscle there's no muscle in that breast, so you got to get those girls' energy moving. And I think that's really important. I have milking sheep at home. I make cheese. I massage my girls' udders every single day. Every time I get them milk, I put bag balm on them and give them a little massage. They love it. They just stand there with their little legs open and you didn't do my massage yet. So it's important. You can go ahead into the next one. The Marseille classification, it's a study done in the Pasteur Institute in France, and it rates the breasts on a scale from 1 to 5. They used over 3,000 women, followed them for 5 years, and looked at which women ended up with breast cancer. That is the cutest baby. And they followed them for 5 years, and then went back and looked at the pictures and came up with a criteria to put them in these categories. TH1 and TH2 are benign. 3 is atypical. Atypical means it's just not the way it should be, but it's not necessarily a pathology yet. And 4 and 5, TH4 and TH5 are much higher risks for malignancy, and you're going to see what I mean by that. So this is a TH1. She's got a small amount of vascular features. See the gauge on the far left-hand side of her picture at the bottom where it's black? That's cold, and at the top where it's white, it's hot. So see up by her jugular, by her neck, how hot it is, because she doesn't have any tissue to buffer it, so it's really hot. So she's got a small amount of vascular features. 0.3 and 4 are big cold features. Those are her fibrous material, fibroadenomas in her breast. You can go ahead. This is a TH2. You can see the vascular features. They look like little lightning bolts. We have a blood supply in our breasts. That's normal. That should be, you should have it pretty symmetric. You could go to the next one. This is the TH3, atypical. So the breast on this side is normal. She doesn't have very much features, but that big feature coming down towards her nipple is something we want to monitor. I usually put her on a protocol, see if we can get it to turn around. Most likely it's a mammary duct infection or an acute cyst. She's probably drinking tons of coffee and eating a lot of sugar, elevates the blood sugar and feeds the cyst. You can go to the next one. This is a TH4. This breast on this side, on the right side of the picture, has a big vascular feature around the nipple and whole breast hyperthermia. I've seen so many women with whole breast hyperthermia totally bruised from a mammogram, inflamed for 3 or 4 weeks after a mammogram. Terrible pain. This is a TH5, very complex vascular feature covering 2 quadrants, craniolateral, conolateral. There, the breast is enlarged, has a big growing tumor. And one other thing is, we put their hands on ice and check them before and after. The blood supply that feeds a tumor can't respond, whereas everything else will contract down. So with her, it did not respond to the temperature change, the autonomic challenge it's called. You can go ahead. I put this picture in here so you can see, this is what I do, is I'm gonna take left, right frontal views. But it gives you a chance to compare how much, each woman's different. Like you saw that woman with completely symmetric vascular features. This breast over here in the left view, that's her normal breast. So you can see how much more features are, those are neoangiogenic blood vessels setting up to feed a tumor. Now the nice thing about this is what the doctors told her she had breast cancer. She came in to see me saying, I don't trust them. Do you think I have breast cancer? And I said, yes you do, and you do not have any lymph involvement. Because I can see lymph involvement. I'm going to show you what that looks like. So she went in and she told him, I just want you to do a sentinel node biopsy, because Nancy told me to do a sentinel node, which is you put dye in the tumor and find only the lymph nodes that are directly involved, take those out, and if they're okay, you don't have to take a whole bunch of lymph nodes out and have their arms swell up and all these things. It's totally unnecessary. And sure enough, she had no lymph involvement, took the little lump out, very early stage, barely even noticed it, kind of made most of the size of her breast more symmetric, and she's doing just fine on a nutritional protocol, no chemo. Chemo is contraindicated for breast cancer unless there's lymph involvement, unless it's spread. Here's a woman who has augmentation appliances. They've been in for 30 years and they're decomposing. All those little spots on the side are her lymph nodes totally inflamed. That's how I can tell when the lymph is involved. That's lymph congestion. Lymph is trying to clean the toxins from the rotting implants. Now when she came into me, she said, I've been telling the doctors I feel like I have the flu. I wake up in the morning, I feel terrible. And he goes, you're 75 years old, you're just getting old. And I'm going, no. So I put in the report, this woman's augmentation appliances are leaking into her lymph nodes. If you do not remove them, you could cause her lymphoma. So that made her insurance company cover her surgical procedure. Now one other thing you can see with her, see how under this breast it's normal and under that breast there's a big white feature? That's her liver is totally inflamed trying to clean this stuff out. So that's how you can see that, and that's how this is part of my full body scans. You can go ahead. Here's a woman with lymphatic toxicity. It looks like marbling all through her body, and this is her after she did my 21-day cleanse. My 21-day cleansing diet is on my website, absolutely free. So go ahead and read it. It's really important, a good thing to do. Amazing what you can do with your body in 21 days. And just taking care of yourself, getting off of all the things your body's sensitive to, gluten and things like that. Here's a woman with ductal carcinoma in situ, that DCIS, where those atypical cells are dividing with dysfunctional DNA. The picture on the left is when I first saw her. I put her on my protocol. The picture over here is 17 months after. It's completely gone. Not only is it completely gone, but the features on the contralateral breast on the other side are actually hotter than any features on the breast that was of concern before. So the protocol really does work, and it doesn't work for everybody. Usually 3 to 6 months a woman can turn around DCIS. So you want to think about why, after all the things I've taught you today, it took her 17 months for it to turn around. It's a long time. Usually 3 to 6 months, and it's better. Anybody got any ideas on all the things I said? Why you think it took her so long? No. She took 26 years of synthetic hormones. She took 16 years of birth control pills, and it gave her endometriosis because it was too much estrogen. So then they took her uterus out and her whole reproductive organs, and then they put her on synthetic hormones again. So they actually gave her breast cancer, or early sign of breast cancer. Here's a root canal infection. See the little zigzaggy line? This is more of what a full body scan shows. And by the way, before you leave, if people are leaving, make sure you get a copy of that purple handout. I don't know if you guys all got that, but you're welcome to it.
Where is it?
I don't know who has that. I gave it to somebody else. Where did you get that copy of yours? Somebody around there? Oh, she did hand it out. So I'll make sure you get it before you go. But anyway, go ahead. You can turn to the next slide, sweetheart. Thanks. This is a woman who is lactating. See what happens when you're breastfeeding? Those little girls get busy, huh? The one thing nice about this, we can see if something's developing, but we're also going to see busyness. I can usually tell what breast they breastfed just before they came in, just by looking at this, by doing a thermography. You can go ahead into the next one. Here's a picture of a guy's eyes. I can see the level of stenosis of the carotid artery and predisposition to stroke. The full body scans are rather extensive. Go ahead. So that's it for today. Does anybody have any questions for me? Yeah. Thank you. Yeah, anytime we're talking about if you have a mammary duct infection or an infection anywhere in your body, if you take sugar, it elevates your blood sugar, it feeds the bacteria. So if you're trying to get rid of a mammary duct infection or a bladder infection, stop eating sugar. The reason I mentioned coffee is coffee has xanthomethylene, which is an acid that blocks fibrinase production, and it causes big, hard lumps in your breast. If you've got big, hard, fibrous lumps in your breast should be nice and soft. They should have a good blood supply. You have that hard, dense stuff, it's not getting good circulation, it's not healthy. So back off on that. Green tea's great, you get the same lift, but it's full of antioxidants, so it's much better for you.
Before you do a thermogram, do you have people not take a hot shower and not
Yeah, no caffeine before they get a thermography. They wouldn't want to come in right after running or doing something hot. If they say, gee, I did a Bikram yoga class before I came into the microphone, I'm going to make them stand there until their features normalize. So they're going to be in a cool room until they normalize before I can take their images. So, some people were looking for that handout. Okay, all righty.
What's your website?
Healthy Breasts to breasts.info. That's all, not .com, just healthybreasts.info. And she's got the handouts, and also my business card has all of that on there, and my emails. I do free counseling for any woman with breast cancer, anytime. So keep my information, she can call me, I'll look at what the doctors have told her and help her make intelligent decisions and not one out of fear. Oh no, I screen in about 15 different locations around the Bay Area and Hawaii. You may have to come to Hawaii if I'm not around. I go to the Big Island in Kauai too, because there's no practitioners on those islands. So I've been doing that for about 10 years now. Okay, yeah. Oh.
So does insurance cover
Your insurance
it?
does? That's a good question. Yes, Blue Cross Blue Shield. That the only one that I know of that won't cover it is Medicare covers it too. The only one that won't cover it is Kaiser. Did you have a question?
Like, are there a lot of people that offer this?
There are other people offering thermography. Not all of them do the Marseille classification, that's where the accuracy rate. Mammograms have a 40% error rate. Thermography have a 9% error rate. So it's much more accurate. So, okay. Did you have any questions?
Thank you, Dr. Nancy.